There are two basic kinds of medication for the treatment of asthma: long-term control medications and quick relief or rescue medications. Long-term control medications are taken every day to prevent asthma symptoms, even when your child does not have the symptoms. Some children may need more than one long-term control medication. Types of long-term control medications include inhaled steroids such as Azamacort, Vanseril, Arobid, and Flovent. These are almost the first choice of treatment. Leukotriene inhibitors. Long-acting bronchodilators, usually used with inhaled steroids. Cromolyn or netocromyl sodium, anophelin or theophylline. Quick relief or rescue medications are used during an attack. Children who do not have symptoms very often or mild asthma may only need quick relief medications as needed. Examples of quick relief medications include Proventil, Ventolin, Xopenex, and others. A number of your child's asthma medicines can be taken using an inhaler. Children who use an inhaler should also use a spacer device which helps them to get the medicine into the lung properly. If your child uses the inhaler the wrong way, less medicine gets into the lungs. Have your healthcare provider show you how to correctly use an inhaler. Younger children can use a nebulizer to take their medicine rather than an inhaler. A nebulizer turns asthma medicine into a mist that you breathe in. It is important to know what things make your child's asthma worse. These are called asthma triggers. Avoiding them is the first step toward helping your child feeling better. If possible, keep pets outdoors or at least away from the child's bedroom. No one should smoke in a house or around a child with asthma. Eliminating tobacco smoke from the home is the single most important thing a family can do to help a child with asthma. Smoking outside the house is not enough. Family members and visitors who smoke carry smoke residue in and on their clothes and hair. This can trigger asthma symptoms. Keeping humidity levels low and fixing leaks can reduce growth of organisms such as mold. Keep the house clean and keep food in containers and out of the bedrooms. This helps reduce the possibility of cockroaches, which can trigger asthma attacks. Bedding can be covered with an allergy-proof polyurethane-coated castings to reduce exposure to dust mites. Detergents and cleaning agents in the home should be unscented. All of these efforts can make a significant difference to a child with asthma, even though it may not be obvious right away. A peak flow meter is a simple device that you and your child can use at home to tell you if an attack is coming, maybe before there are any symptoms. Checking peak flow is one of the best ways to control asthma. It can help you keep your child's asthma from getting worse. Asthma attacks do not usually come on without warning. Children under age 5 may not be able to use a peak flow meter well enough to make the numbers useful. An adult should always watch carefully for a child's asthma symptoms. It's a good idea to start using peak flow meters before age 5 to get the child used to them. With proper treatment and a team approach to managing asthma, almost all children with asthma can live a normal life. However, poorly controlled asthma may lead to missed school, problems playing sports, missed work for parents, and multiple visits to the doctor's office and emergency room. Many times, asthma symptoms occur much less often or disappear as the child gets older. However, if the child's asthma is not well controlled, it can lead to permanent changes in lung function. Asthma can rarely be a life-threatening disease. It is important for families to work together with healthcare professionals to provide a plan to properly care for a child with asthma. Complications of asthma can be severe. Some include persistent cough, lack of sleep due to nighttime symptoms, decreased ability to exercise and take part in other activities, missed school, missed work for parents, emergency room visits and hospital stays, trouble breathing that requires breathing assistance, ventilator, permanent changes in the function of the lungs, death. Call your healthcare provider if you think that a child has new symptoms of asthma. If your child has been diagnosed with asthma, call the doctor. After an emergency room visit, when peak flow numbers have been getting lower, when symptoms are more frequent and more severe, and your child is following the asthma action plan. If your child is having trouble breathing or having an asthma attack, seek medical attention immediately. Emergency symptoms include difficulty breathing, bluish color to the lips and face, severe anxiety due to shortness of breath, rapid pulse, sweating, decreased levels of alertness such as severe drowsiness or confusion. A child who is having severe asthma may need to stay in the hospital and may need to be given oxygen and medicines through the vein.